Hi, this is Jeff Zeig. This is a series, Stories with Milton Erickson. I'm in Phoenix, Arizona. I'm in the offices of the Milton Erickson Foundation. I'm the founder and the director of the Erickson Foundation, which is now having its 40th anniversary in the year 2019. So I'm continuing telling some stories about my experiences with Dr. Erickson. When I visited Dr. Erickson in 1973, he indicated to me that if there were patients with whom I could sit in, and they were not psychiatric patients, or often at that time wanting more privacy. And so in my initial visit in 1973, I really wasn't able to sit in with him. But there are some stories that I can relate about patients. One of the stories that comes to mind is that Dr. Erickson had a young man who was seeing. He came from northern Arizona, and Dr. Erickson said to me, "Jeff, please see this young man." There was no other instruction other than see this young man. So, oh my gosh, I'm sitting in Dr. Erickson's office. I'm on his office chair, and I'm doing the best therapy that I knew how at the time with this young man. And because I had been trained to be a good supervisee, I wrote up a case description. I was looking mostly at psychopathology at the time, not about resources. What was a diagnosis? What could be a treatment plan? And when Dr. Erickson asked me what did I think, I gave him this elaborate description of what I thought was happening with the patient and the patient's psychiatric structure. And Dr. Erickson just shook his head and looked at me and he said, "Jeff, the boy just needs a brother to talk to." And that turned me a little topsy-turvy in my understanding of looking for pathology, which is what I was trained to do at the time, and not to look for an understanding of what resources are available and what is really needed in the immediate situation. I can remember another one of my favorite experiences with Erickson that was also instrumental in helping to develop Jeff Zeig. I was visiting Dr. Erickson, and I slept in his guest room, which was adjacent to his office. And he was seeing a patient, and I took a nap. And there was a knock on the door, and I opened the door, and there was a woman, stunningly beautiful. She looked like she was dressed for a photo shoot for the cover of a fashion magazine. And she said, "Dr. Erickson wants to see you." And I said, "Okay," and I woke myself up and went into the office. Now, the office was small. It had just a few chairs, 2 chairs. Dr. Erickson was sitting in his office chair. There was a small table, and the woman, let's call her Cathy, was seated in the client's chair, and I was seated in the chair adjacent to her. And there on the table was a pair of sunglasses. And Dr. Erickson introduced me and said, "Jeff, this is Cathy." And said to Cathy, "Cathy, this is Jeff Zeig. He's a therapist from California." She said, "Oh, a student?" He said, "No, a therapist." And Dr. Erickson said, "Jeff, Cathy said that she wore her sunglasses to protect herself from the hostile world. But I said you don't need them in here with me." And there were her sunglasses, and they were on the table. And then Erickson looked at me and said, "Isn't she pretty?" And I said, "Well, yeah." "And doesn't she have beautiful eyes?" And I said, "Uh-huh." And then he said, "Doesn't she have beautiful lips?" And I said, "Yes." And he said, "Aren't her lips kissable?" And suddenly I started to sweat. And I'm thinking, am I the patient? Is she the patient? What is happening here? And what does all of this mean? And Dr. Erickson was getting animated in his chair. "Doesn't she have beautiful legs? Wouldn't she be a good friend to your cousin?" He knew my cousin. "Wouldn't she be a good friend to my daughter?" And this went on for quite some time. "Couldn't she be a wonderful wife?" And I'm thinking, oh my gosh, he's trying to get me married again. He tried to interest me in dating another patient. And then, like a magic trick, suddenly Dr. Erickson disappeared from his office. Mrs. Erickson rushed in and wheeled Dr. Erickson out of the office. I guess he was sitting in his wheelchair and not in his office chair. Well, Dr. Erickson had an emergency buzzer underneath his desk that signaled the main house that there was an emergency. And without my seeing it, he must have pressed that button, and Mrs. Erickson rushed in and took him away, and I was left alone with Cathy. And I'm stunned, and I don't understand, and I say goodbye to her, and she leaves, and I'm walking around trying to understand what was the meaning of all of this, what happened. And then there's a knock at the door, and it's Cathy, and she comes again to the door, and sheepishly embarrassed, she says, "I forgot my sunglasses." And her sunglasses were still there on the table between us. So I gave Cathy her sunglasses. I thought about it for a minute. When Dr. Erickson went into the main house at the end of the day, I didn't disturb him because that was private time, but I knocked on the door. I said to Mrs. Erickson, something just happened with the patient. I'd like to talk with Dr. Erickson. And she checked, and he said, okay. And breathlessly, I said to Dr. Erickson, "Cathy forgot her sunglasses." And he just nodded as if he expected it. And I said, "You expected it?" And he nodded. And I said, "You set it up?" And I said, and he nodded. And I said, "Well, how did you do it?" He said, "Well, she said she needed her sunglasses to protect herself from the hostile world." I said, "You don't need them here with me." And then he said he told her stories, boring stories, what we would call a shaggy dog story, a story that goes on endlessly and may not even have a conclusion. But in these stories, he interspersed the idea of forgetting, glancing at the sunglasses. That somebody could go to the store, see an item that they like, think maybe I'll buy it, maybe that I won't, and then go to another store, etc., etc. Think about what was seen in the first store and go to a third store and suddenly realize you forgot your keys in the second store. And he would intersperse the idea of forgetting. And then he told me the story about Cathy, that she had grown up in an environment where her parental figures were disapproving of her, criticizing her of not being a real woman. So having insecurity about her own femininity, Cathy dressed in a hyper-feminine way, but still didn't feel secure about who she was as a woman. So Dr. Erickson had a young man. If you have a young man, utilize him. So I was giving compliments to Cathy, but I wasn't giving compliments to Cathy. Dr. Erickson was giving compliments to Cathy. But Dr. Erickson wasn't giving compliments to Cathy. I was giving compliments to Cathy. And Cathy had a tendency to discount, oh, he's just a student? No, a therapist. And there was very little that Cathy could discount. And I found out something about myself, my ability to deal adequately with pressure and not to get anxiously overwhelmed with it. So that was a moment of realization in another way. When she forgot her sunglasses, Dr. Erickson said to me, "Jeff, she's beginning to believe in me." And that was a moment in which I understood the imperative nature, hypnotherapy without trance, but building responsiveness to the innuendos in communication. This is like Erickson, who was a farmer, was gardening. If you have a seed, make sure that the soil is prepared to accept the seed. Make sure that the ground is fertile. Build the fertility of the soil before you plant the seed. Developing responsive behavior, response to innuendo, response to implication, is one of the cardinal moments of creating a hypnotic induction. The hypnosis begins when the person starts to respond to the implications in the communication, and this can be done through formal trance or through hypnotherapy without trance, what Dr. Erickson called a naturalistic trance. So that moment stands in my mind of understanding how Dr. Erickson would build response to innuendo which again is the basis of anyone telling a joke. You're responding to the meaning that the joke contains, and the joke is an induction to realize humor. So that was one of the many experiences that I had with Dr. Erickson that was instrumental, not only in my professional development, but also in my personal development. This is Jeff Zeig here in Phoenix, Arizona. More stories about Milton Erickson.